section, we'll be going over member-related information. Member handbook. Mercy Care contracted providers are required to treat all members with respect and dignity. All providers and their staff are responsible to become familiar with member rights and responsibilities. The rights and responsibilities are incorporated in the provider manual and can be accessed in the member handbook using the below links. As you can see here, once you log into our website, you can go under For Members, and it will provide you with the member handbook and member resources and a bunch of other great resources for our providers. With the member handbook, please do not download the handbook because it does change from time to time. If there are any updates to the handbooks and so forth, most times provider communications will be sent out letting you know of those updates, and that we will make sure to get those out to our providers. Transportation services. Mercy Care members are entitled to many different services in which it is the provider's responsibility to coordinate. Transportation is also included as a benefit. Medically necessary non-emergent transportation services are covered for access members. Members are able to set up their own transportation by calling the member services department within 3 days prior to the appointment. We ask for a 3-day notice to make sure that we can get entered into the system and make sure that we have transportation set up for the member. When it is called in on the same day or less than 3 days, there could be an issue with securing transportation for the member for their services. Some members may not be able to call in and schedule their own transportation, maybe due to cognitive or physical abilities. Some providers can definitely call in for the member and help the member get that transportation set up. Interpreter services. Most of you hopefully are aware that effective February 1st, 2022, Mercy Care providers must contact Mercy Care member services directly for scheduling interpreter services that are being requested. Providers will no longer schedule requests with interpreter vendors directly. Everything goes through our member service department. Depending on the member's eligibility, you will contact the departments that you see here. As you can see, we have it broken down to ACC, DD, REVA, Mercy Care Advantage, DS, Mercy Care CCS, CHP. And then also, too, you'll need to let them know if it is for a clinical appointment or non-clinical. And then there are specific codes that we use as well to set up the interpreter services. And then you can always use the link below as well if you have some additional questions. Prior authorization, or also we call them PAs. So with prior authorization, if it is a routine prior authorization, it can take up to 14 calendar days to process in the system. If it is an urgent prior authorization, it can take 72 hours. Mercy Care receives prior authorizations for select acute outpatient services, ABA services, and planned hospital admissions. Prior authorization is not required for emergency services. For full details about PAs and how to obtain a PA, please visit our website below. You can check the status of a prior authorization, and this can be done through either of the secure web portals. And for any additional information regarding prior authorizations, you can definitely look that up in our provider manual as well. And then below, as well as we provide the fax number where the authorizations should be faxed to. Some additional information regarding prior authorization. Mercy Care does have a tool for providers to use, and it's called ProPath. This allows providers to go in and enter up to 6 CPT codes or HCPCS codes at a time. It allows you to pick the plan that the member may be on, and then you'll hit the search button, and then it will tell you if the code would require a prior authorization or not. We have listed here some of the results that may pop up when you do this. If there's any questions, just let us know. Next topic is we have advanced directives and end of life. The advanced directive is a document by which a person makes provisions for healthcare decisions in the event that in the future they become unable to make those decisions. The advanced directive must be promptly displayed in the adult member's medical record as required by the federal and state laws. So we do have a form on our website for advance directives if you need one. If the member already has one, great. A copy just needs to be entered into their folder, their file. Also, if a member has a living will or a power of attorney that can be in place of an advance directive, that works as well. Just make sure that you have that for every adult member that you see in your office. Mercy Care believes that our community continues to grow and become more ethnically diverse. The care that we provide is consistently evolving and becoming more complex. Providers are encouraged to address members' concerns according to their literacy and culture, as well as providing language, access services, and culturally competent care are the priorities of Mercy Care Cultural Competency Department. Below are two key things that providers can do to help their patients. And as you can see, we list those two items here. For more information, you can definitely take a look at our Mercy Care Cultural Competency webpage, which we have linked right here for you. Thank you and have a great day.